Jack it up. Jack it up.
Hello viewers, welcome back to our next video. Today we'll be driving you through pharmacology. Before studying the mechanism of actions of drugs, it is important to understand what is pharmacokinetics and the pharmacodynamics. But today we'll be going through pharmacokinetics. Now, to understand what is pharmacokinetics is what the body does to the drugs. To quickly remember, just what the body does to the drugs is what we call pharmacokinetics. When the person take in the pills or apply a cream, the drugs is firstly absorbed. When the drugs is absorbed, it either reaches the stomach or it is absorbed through the skin. When it's absorbed through the skin or the stomach, it gets into the bloodstream. When it gets into the bloodstream, it goes through the fluid in and out of the cell, and then it becomes distributed. When it is distributed, it gets into the liver. When it gets into the liver for what we call metabolisms. When drugs enter the liver for metabolism, it is biotransformed, called a biotransformation. It will undergo biotransformations. When it undergo biotransformation, it goes to the kidney for eliminations. The kidney is the primary organs for drugs elimination. But there are other organs that also eliminate drugs, like the skin, the salivary glands, the earwax, and the rest of them. But the kidney is the primary organs for elimination of drugs. So quickly, we will be going over pharmacokinetics. What is pharmacokinetics? There are 4 different parameters of pharmacokinetics. Those parameters are absorption, distribution, metabolisms, and eliminations. Now, we will be looking at absorptions and distribution in this lecture. In the next lecture, we'll be looking at metabolisms and elimination. Now, when a drug is administered to a patient, either through parenteral route, topical route, oral route, nasal route, any route, when the drug is administered to the patient, it is firstly absorbed. So for example, IV. These are IV drugs, meaning intravenous, meaning the drugs is given within the vein. When this drug is administered to the patient, it reaches the bloodstream. It reaches the bloodstream directly. When it reaches the bloodstream, what happens? It is absorbed. Or when the drug is also given oral PO by the mouth, it is also absorbed. When the drug is absorbed, it reaches the systemic circulations and it gets distributed. Now, absorption of drug takes place in 4 different ways. There are 4 different ways absorption of drugs can take place. The 4 different ways are passive diffusions. Passive diffusions, that is one way in which drugs can be absorbed. Facilitated diffusions, active transport, and endocytosis. So when the drug is given to the patient and is absorbed, means the drugs have to cross the cell membrane. When the drug crosses the cell membrane and reach to the bloodstream, then it's given distributed. So that occurs in 4 different ways. We get passive diffusions, facilitated diffusions, active transport, and endocytosis. So that we will be seeing what we call passive diffusion. So in passive diffusion, the drug's molecule here will leave from high concentrations to lower concentration. Let's understand something. We say passive means to pass from one point to another. And the word diffusion means from high concentration to lower concentration. So means the drug molecule is going to cross the cell membrane. The drug molecule is going to cross the cell membrane from higher concentrations to lower concentration. But in passive diffusion, it will cross the cell membrane by a channel, by the help of a channel. So the drugs will leave from high concentration to lower concentration by the help of a channel. So, unless water-soluble drugs, so water-soluble drugs will require a channel to cross the cell membrane. But if you come to lipophilic drugs, liposoluble drugs, it do not require any channel. It do not require any channel to cross the cell membrane. So we talk about facilitated diffusions, another means for drugs to be absorbed. So we talk about facilitated diffusion. So facilitated, in another word, what helps the drugs to leave from one place to another. In the same way as passive diffusion, it leaves from higher concentrations to lower concentration. But here, let's say, transported by the help of a protein channel. So the protein channel will help the drugs to leave from higher concentrations to lower concentrations. So the drugs will be, in the facilitated diffusion, drugs is leaving by the help of our protein channel. So we look at active transport. Under the active transport, here, there are energy required for the drugs to cross the cell membrane. For the drugs to cross the cell membrane, there are energy required. It requires energy. So what happens? ATP in the process of hydrolysis will be converted into ADP to produce a phosphate bond. So, in the passive diffusions, for drugs to cross the cell membrane, it requires high energy level. Energy is what? Required. So that with endocytosis, and endocytosis has to do with the engulfments of the drugs molecules by the channel or by the molecules. So the engulfment of the drugs molecules will occur in the endocytosis. So these are the 4 major ways that drugs can be absorbed. So the absorptions of drugs mainly depends upon few factors like pH. It depends upon the pH factors, the acid-base balance. That is one factor. The surface area. It also depends upon the surface area. The absorptions of blood also depends upon the blood flow. Now, then there comes the questions of bioavailability. If a drug is administered to a patient, how many of the drugs reaches the systemic circulations? That's what we call drugs bioavailability. Under that, the drug is given in 100 mg to a patient. If that all of the 100 mg reaches the systemic circulation, where is the blood flow? The question is no. All of the drugs' strength cannot reach the bioavailability, or cannot reach the systemic circulations, or cannot reach the blood flow. The answer is no. All of the 100% cannot reach. Now, so to understand this, let us look at the drug's bioavailability curve. Now, if a drug is administered to a patient, now through IV, that's intravenous, means here the drug is directly interacting with the blood flow or the systemic circulations. So means the bioavailability is going to be 100. It's directly injected into the bloodstream, so the bioavailability will be 100. So if the drugs is given oral, means that some of the drugs will be absorbed. So there will be a curve in the availability curve, in the bioavailability curve. So there will be a curve. So to get the drug bioavailability, meaning here you say the AUC oral, AUC IV. So mean the time, the plasma protein over the time. So we say the bioavailability is equal to the AUC oral divided by the AUC IV into 100 to get the bioavailability of the drugs. Now then we come to what we call distributions of drugs. It's when a drug get absorbed Meaning one, it crosses all of the membranes. Meaning passive diffusions, facilitated diffusions, endocytosis. When it crosses all these things, when it gets absorbed, it gets distributed through the body. When it gets absorbed and it gets distributed, it depends upon few factors. The factors of distribution for drugs to be distributed throughout the body, it depends upon few factors. One is the lipophilicity. That is one. Means that drugs molecule, lipophilic drugs molecule will easily reaches the cell membrane, will easily be distributed than hydrophilicity drugs. So these drugs are not easily distributed within the body. That's one factor that depends or that determines the distribution factors of the drugs. Now, another factor is the blood flow. Now, all of the organs in the body do not exhibit the same blood flow or do not contain the same blood flow. Some organs receive higher blood flow than the other organs. So, you must know that the chief carrier for drugs is what we call the blood. So the blood is responsible for, we call it the chief transport. So it's responsible to carry drugs molecule. Now, organs like the brain receive a higher blood flow than the skin. So when the drugs is administered, the brain stands a better chance to get more drugs absorptions than the skin. So the skin will receive lesser drugs. That's why more often they produce ointment, cream to be used on the skin. So another factor here is binding of plasma protein. Only drugs that are in a free form will be metabolized. When the drug is administered to a patient, some are going to bind with the proteins albumin. There is a binding site of the drugs, there is a binding protein in the body. So these drugs will bind to proteins and they will not be distributed. So when the drugs bind to proteins, what happens? The half-life increase. What is half-life? Half-life is the time taken for 50% of the strength of the drugs to be metabolized or to be eliminated. So when it binds to protein, here what happens? The half-life is going to increase. The half-life of the drugs will increase. So it also affects the distribution factors. Another one is the volumes of distributions. So the volume of distribution of the drugs also play a key role in the distribution factors. Means that the volume of distribution is the amount of drugs in the body divided by the concentrations of drugs in the blood plasma. So it also has to do with if the volume of drugs is directly proportional to the amount of drugs present in the body. Means if the volume of drugs is increased, means that the amount of drugs in the body should be increased. And the volume of drugs is inversely proportional to the concentrations of the blood present in the plasma protein. So if the volume of drugs increases, then the concentrations of the drugs in the blood plasma will decrease. So the volume of drugs will also affect the distributions of the drugs. Thank you guys. We hope to see you in our next video. Please do not forget to subscribe to our channel and hit the notification bell to be notified for our upcoming video. Thank you for watching. Thank you guys.
Jack it up.